The topic of this talk is about extending regression without truth to integrate ground truth known data for evaluating quantitative imaging methods with patient data. The clinical context we considered in this study is about evaluating quantitative SPECT methods for quantifying regional activity uptake in radiopharmaceutical therapy. So in alpha particle radiopharmaceutical therapy, it is important to quantify the regional activity uptake in lesions and radiosensitive organs. For this purpose, different quantitative imaging methods have been developed. So one key question is that which quantitative SPECT method is yielding the most reliable quantification of the mean regional activity uptake. Ideally, we want to compare all these measurements of different methods with the true value. However, with patient data, there's no true activity values available. So in this context, a class of regression without truth techniques have been developed. These techniques simply assume that the true and measured values are linearly related, and then by assuming that the true values are sampled from a parametric distribution, these techniques are able to estimate the linear relationship parameters using a maximum likelihood estimator. And after estimating the slope and bias and noise standard deviation terms, this technique can use the slope and bias term to calibrate the measurement. Then the noise term will be scaled by the reciprocal of the slope term, so that these techniques are using the noise-to-slope ratio to compare different methods based on precision. These techniques have been shown efficacy in multiple different applications, including evaluating segmentation methods and reconstruction methods across SPECT, PET, and MRI, and so on. However, for clinical application of this technique, one key challenge is that these techniques are requiring a large patient cohort. Considering that while evaluating 3 different methods here, we have 3 slope terms to estimate, 3 bias terms to estimate, and if we are considering the correlated noise between these 3 different methods, there will be 6 parameters in the covariance matrix. And if we are considering a 4-parameter distribution for the true value distribution, there will be 4 parameters. This gives us already 16 parameters to estimate. Based on our experiment before, for estimating these 16 parameters, we require at least 200 samples. So acquiring such a large patient cohort could be expensive, and in many cases, it is actually impossible. For example, first of all, like this image study is inherently expensive. Like one PET scan can cost around $1,000, and such a study can cost around more than $200,000. In other cases, such as we are developing quantitative biomarker for rare disease, or we are doing quantitative imaging for new radiopharmaceutical therapies, these cases patient data could be inherently limited. So in these cases, there's an important need for those strategies to evaluate quantitative imaging methods with a small patient cohorts. In this case, consider that except the clinical dataset where we do not know the ground truth, there may be some datasets that we actually know the ground truth. For example, there might be a very small number of patients where we have gold standards such as bone biopsy or urine sample. And we can also do physical phantom studies where we know the ground truth, and realistic simulation studies we also know the ground truth. So this inspires that can we actually incorporate the information from studies where this ground truth is available to help the estimation of linear relationship parameters. So inspired by this, we are developing a method so that we can incorporate such information. Now let us go into this method. First, consider that this is the patient dataset where we do not know the ground truth, and this is one of the patients there, the PIS patient. And then we can write the relationship between the measurement and the true value using this based on this linear relationship here. So consider we're doing another study in the a physical phantom study. We can also write the measurement and the relationship between the measurement and the true value using this equation. Now, based on these two equations, we can write the probability of all the measurements for the PIS patient using this equation. Similarly, all the measurements for the Q's physical phantom study can be write, the probability of that can be write using this equation. So we can see that these two probabilities depend on the true values. And for the physical phantom study, we know the true value. However, for the patient dataset, we do not know the true value here. Now, for this case, let us assume that the true values are samples from some distribution parameterized by omega, and the joint distribution of all the moment and the true value can actually be given by this equation here. And then by marginalizing over the true value, we are able to obtain the distribution of all the moments for the PIS patient, which actually does not depend on the true value. So next, if we assume that the true values of all the patient data set and the physical phantoms are independent of each other, the likelihood of observing all the moments of the two data sets can be given by this equation. And then by maximizing the log likelihood function, we're able to estimate the true value distribution parameters and all the linear relationship parameters. And then we can first use the slope and the bias to calibrate the measurement, and then it will yield us with a noise term with the noise standard deviation given by the original noise standard deviation divided by the slope term. So we can use this noise to slope ratio to compare different methods based on precision. We refer this technique as the hybrid regression without truth technique here. So to validate this hybrid regression without truth technique, we first consider a numerical study. In numerical study, it can provide us with a control setting that all the assumptions we made here are satisfied. So first we can generate true quantitative values from a known 4-parameter beta distribution. And then we can generate measurements of 3 hypothetical quantitative imaging methods using known linear relationship parameters. Using only these measurements, we can do evaluation using regression without truth technique. On the other side, we can generate another dataset where we know the with the true values. And with this dataset with true values and all this only measurement where we do not know the true values, we can conduct evaluation using hybrid RWT. So the good part with doing numerical study is that we actually know the true values for all of the linear relationship parameters. So which means that we know the true noise to slope ratios. So first thing we could look at is the estimation performance of these two approaches in estimating the noise to slope ratio. Here, so we can look at the normalized bias and the standard deviation in estimating the noise to slope ratio by repeat this process for multiple realizations. And also with the known true noise to slope ratio values, we know the true rankings of these 3 hypothetical quantitative imaging methods, so that again we can compute the percentage for correctly ranking the methods or identifying the best method. Now let's first look at the comparison for evaluating the noise to slope ratio. Here the y-axis is the average absolute normalized bias, and the x-axis is the number of samples, and the legend here, the red one is the RWT, and the others are hybrid RWT with this dash number, which means that the number of known ground truth samples we incorporated here. So as we can observe that by simply incorporating only 5 known ground truth samples, the absolute normalized bias already for estimating the noise to super ratio already decreased a lot. And with the increase of the ground truth known samples, we can see the absolute normalized bias continues to decrease. And similar results we can observe for the normalized standard deviation for estimating the noise to super ratio. Next, let us look at the performance for ranking the 3 hypothetical quantitative imaging methods. The y-axis here is the percentage for correctly ranking the 3 methods. And we can see by incorporating only 5 ground truth known samples, the percentage for correctly ranking improved a lot comparing to the simple regression without truth. And with the further incorporation of the known ground truth samples, the ranking performance continues to improve. Again, like in the clinic, sometimes we do not care about ranking all the methods. Instead, we care about identifying the best method. So here, we also look at the percentage for correctly identifying the best method here, where we can observe similar results. So we can see hybrid RWT can actually outperform RWT in ranking the methods and identifying the most precise method. And with more ground truth known data incorporated, the ranking accuracy continues to improve. So with the results in the numerical studies here, we're wondering if we can observe similar results in a more clinically realistic setting. So for that purpose, we also conducted the validation using a virtual imaging trial. Here we consider the context of evaluating quantitative spectrum methods on the task of quantifying mean regional activity uptake in radiosensitive organs in alpha particle radiopharmaceutical therapy. We consider first 2 methods as reconstruction-based quantification. The first one is OSM reconstruction, which only compensated for attenuation. And the second one is OSM reconstruction, which compensated for attenuation, scatter, collimated detector response. And the last method is the recently proposed low-count quantitative SPECT methods, which directly quantify the mean regional activity uptake from no projection data. In this virtual imaging trial, we first generated a large patient cohort, and it was imaged by a simulated GE Optima 640 SPECT system. And then we use these 3 different quantitative SPECT methods to quantify the regional activity uptake in radiosensitive organs. And then we can randomly sample a certain number of patients without ground truth, and we can do regression without truth. On the other side, we can randomly sample another dataset with known ground truth. So we can do with this unknown ground truth data and the known ground truth data together, we can do hybrid regression without truth. And again, by repeat this for multiple trial instances, we can compare the accuracy of the hybrid RWT and RWT in ranking these three quantitative spectrum methods here. So for compare the accuracy in ranking the methods, which requires the true ranking here. So what we did here is that we did a linear regression with ground truth. Since this is the simulation study, so we know the ground truth. So we do regression with ground truth of the whole data set. So we can see here OSEMA is having the largest noise to SOAP ratio, and then OSEM ADS and the LCQ SPECT is having the smallest noise to SOAP ratio, so it's the most precise one. So we refer to this ranking as the true ranking. We compare the ranking results of RWT and hybrid RWT with this true ranking here. Another thing I wanted to mention is that for each patient, we consider 4 radiosensitive organs, which are the large and small intestine, bone, and the background. The other regions we refer to as background. Now let us see the results here. The y-axis is the percentage for correctly ranking the methods, and the x-axis is the number of patients, and the number of patients is varied from 10 to 50. I want to emphasize that for each patient, we consider 4 organs, so the number of samples is 40 to, for example, the 200. In the legend here is this one is the RWT, the red one is the RWT, and the others are hybrid RWT. With the dash number indicates the number of known ground truth patients, and again, for each patient, we consider 4 different organs. So, for example, this for HRWT-1, which means that we consider 1 patient with known ground truth, but it's corresponding to 4 samples. Again, we can observe that with only incorporating 1 patient with known ground truth, the percentage for correctly ranking these 3 different methods improved a lot. And with the increase of the known ground truth of patients here, we can see the improvement of correctly ranking the methods continues to improve. We also look at the percentage for correctly identifying the methods. And we can see with the only incorporating 1 known ground truth patient, the percentage for correctly ranking the method already almost like achieved 100% accuracy. So we can see that hybrid RW outperforms RWT in ranking the methods and identifying the most precise method, where the ranking accuracy improves as the ground truth known data increases. So with that, I'd like to conclude that in this study, to address the challenge of evaluating quantitative imaging methods with small patient cohorts, we developed a hybrid regression without truth technique that incorporates information from ground truth known data, such as physical phantom studies. And our initial validation using numerical experiments and realistic simulations demonstrates that hybrid RWT achieves reliable and improved performance compared with RWT. Some trade-off in this study, we did our evaluation using numerical and simulation study. A future direction is to validate the proposed approach with clinical data and physical phantom study. So with that, I'd like to thank all the members, the collaborators, and funding agencies.